let's talk necks, guys. This is often the first place to show signs of ageing. And that's twofold, mostly because we put very posh skincare on our faces and we forget to put it on our necks. So my first recommendation for you is any serums that go on your face, start putting it on your neck. And also your SPF and your sun protection, don't forget to do your neck and your décolleté. For treatments of necks, depends on your problems. Sometimes we can start getting these horizontal lines going across our necks. Sometimes we can start with the lower face and neck sort of jowling and a volume increase. And it can also sometimes be crepiness of the skin. So the skin starts to look aged with losing hydration, losing its collagen and elastin and starting to form little lines going vertically rather than horizontally. For horizontal lines, depending on assessment, obviously, but sometimes it's the best thing to start with is muscle relaxing injections. By relaxing the platysmal muscle that we have going across the neck, stops that muscle contracting down and creating these horizontal lines and can smooth the neck out and also can help define that jawline if that's one of your problems. For crepiness and as the skin ages losing its collagen and elastin, we've got skin boosters. And we've got a lot of skin boosters and it depends on what your specific concerns are. But the options include a pure hyaluronic acid in something like Profilo, which would help stimulate collagen but also deeply hydrate that tissue. We've got something like polynucleotides, which is fractionated DNA, which instigates collagen by kick-starting your skin cells to create collagen and elastin, those fibroblasts, but also has hyaluronic acid in there, so has a moisturiser component in there as well. I personally absolutely adore microneedling with exosomes. I like a bit of microneedling because that is creating micro trauma to get the skin to heal itself and heal itself better by stimulating that healing cascade. I'm doing that specifically with exosomes, which is the latest in regenerative medicine. It is a nanoparticle that's how the cells communicate with each other, and that is beautifully moisturising but really helps that collagen and elastin production and gives you a real glow. I also quite like that because it can treat the neck and the face all at the same time. With other things that we might be used, it's always medical grade skincare. So whether that's neck specific or whether we're utilising serums on the face and the neck, there's lots of different options. And then we've got biostimulators. So that is real things that really stimulate collagen in the forms of things like Sculptra, which is a powerful biostimulator that can really create that collagen, but also help lift. For energy-based devices, so going away from the injectables and the microneedling, for something like a high-intensity focused ultrasound, really good if you're starting to get a bit of extra volume here and a bit of a double chin and starting to get some jowls. That uses focused ultrasound, that's high-intensity focused ultrasound for your HIFU, and that really helps stimulate collagen, reduce volume, and also can help reduce the fat. If you've got a really stubborn pocket of fat here, it might also be that rather than that, we go into fat dissolving injections and use a injectable that reduces the amount of fat cells that you've got under your double chin. But that would depend on assessment, coming to see us, and I tend to use my ultrasound imaging machine so I can see exactly how much fat you have and if it's worth the treatment cost and the treatment downtime for any of these things. What's good is always come in and have a bit of a chat to us. We can go through the many pros and cons of what we can offer in clinic and we can pick a regime that's good for you, whether it's one treatment, a few treatments or a combination of quite a few. Look forward to seeing you in clinic. Thanks guys.